Good afternoon and welcome. We're in the home stretch of our big day of training here at Compression Care, and I'm just told that nearly 500 of you have participated throughout the day today, and that's just amazing. This session had one of the highest signups, so we know you're all trying to make sure your patients don't pay more than they have to for the care they need, and I'm going to run you through three key ways we can help. I'm Stephen Ludwig. I'm one of the co-founders of Compression Care. Joshua Perkins is here, our Chief Operating Officer. And we spend a lot of time in the background making sure we're delivering on affordability for patients. This year, it's really become right to the forefront. And we're going to chat about a number of things today. I've put a couple of things in the chat already. There's a link to a resources page so that when we're all done here, you can see all the materials, the slides, the videos, the everything for all the sessions, and you can go get a certificate for attending this one and any others that you do, so that you can submit those to your accrediting body and try and get CEUs for it. We've also got a Microsoft Teams virtual lounge running all day. This has been fun. Several members of our staff are in there. And they've had an opportunity to meet some of you, put faces with names, and it's been great. And they have links to everything. They have answers to questions. They'll help you make sure that you get pointed in the right direction if you need anything from us. So we'll review those again before we break up for the session. But just wanted to make sure that you kind of got that housekeeping out of the way. One thing that's made us a leader in affordability is the synergy created by our acquisition of compressionguru.com last year. It's made a big difference, and we'll talk about how you can use that, especially for self-pay patients, to keep costs down. And we'll talk about how that's been a great benefit for patients with health insurance too. But the primary thing you need to know about Guru, because it factors into everything else we're going to talk about today, is that we sell just about everything at what's called MAP, or minimum advertised price, which is the lowest retail price allowed by the manufacturers. And not everything has a MAP, but in those cases, we have a pretty straightforward pricing strategy, and we view self-pay as the safety net for patients who don't have adequate health insurance coverage. So we don't want to lose money selling at Guru, but our focus here is on affordability. And so that's a really key part of our mission, which is to make high quality compression care accessible, affordable, and convenient no matter where you live. And affordability, like I say, has become it's come really to the forefront this year. And let's face it, costs have been going up all over the place, and compression garments haven't been an exception. Since 2020, we've had at least one, often two price increases per year from most of the manufacturers. I think Juzo, Josh can correct me if I'm wrong, but I think Juzo might be the only manufacturer who has not increased prices again at the beginning of this year, after we just had a price increase like middle of last year. And meantime, the average premium increase in commercial healthcare, health insurance, it has been between 20 and 30%. We thought our group cost going up 20% this year was awful, and then we found out that other people were 30, 35, sometimes 40%. It's crazy. But I think that patients are getting squeezed on every front. Higher premiums. In order to get premiums back down, they're having to increase deductibles, co-pays. They're seeing it, you're seeing it, we're all seeing it. So we're being aggressive about affordability, and we're using all of our resources to reduce obstacles for patients at every stage of treatment. So I'm going to take this talk and break it down into each stage of treatment in order to show you our most common use cases on how you can make sure the patient is paying the least out of pocket all along the way. When patients are in active treatment and reduction with you in your clinic, some of the most common needs include items that are typically not covered, such as bandaging, skincare. Since these are almost always self-pay, and often speed is a serious consideration. This is where having Guru in our mix can save you a lot of time and make sure the patient pays the least for what you need them to have. And there are 3 ways you can initiate a self-pay patient referral. If you're already logged into our Peace of Mind portal at Compression Care, that's now linked to the Guru site. You can click self-pay patient referral on the menu in the upper left corner of the dashboard, and you can select any patient or add a patient if they're new. And then it gives you essentially a shopping cart. You can add the items you want that patient to have, hit submit. That referral goes straight to the lovely Judy Nelson, our in-house sales rep at Guru. Patients absolutely love Judy, and she is awesome at helping them either purchase those items from the website or right over the phone. She'll put them in a cart for them. They can just purchase the cart. For your patients who are super low tech, she just helps them right over the phone and we ship it out. So whatever's easiest for them, that's how that works. And if you're logged in at the Guru site, we've added 2 new features there that therapists seem to really love. We've been testing this with a few select people just for a couple weeks. And several people have said to me that I'm going to do this all the time now. The first is our new cart to quote feature. And you activate this feature on your Guru account by just asking us to upgrade your Guru account, your login, to our new medical professionals level. What that does is it puts you, it makes available to you some features that only medical professionals can see. And I'm putting a link into the chat right now that takes you to a landing page on Guru that is just for medical professionals. And it shows you how you can either create an account if you don't yet have one, or if you already have one, how you can ask us to upgrade it. And once it's upgraded, you'll have full access to the cart to quote feature. And when you have that, here's how it works. We can, it works a lot like the shopping cart, except you go shopping, you put and you select items that you want this patient to have. Instead of clicking add to cart, you click add to quote. And what you're doing is you're building a quote for your patient. What you'll notice is that when you start building a quote, in addition to the little shopping cart up here in the upper right, you're going to have a little dolly with some boxes on it. That's a quote. Okay. So just keep tabs on the difference between the shopping cart and the dolly, and you can keep track. So you're building a quote. When you've got everything in there that you want that patient to have, instead of selecting checkout, you select send quote to patient. And it's going to ask you to provide the patient's contact information. And it's also going to let you include a note for the patient, some instructions, or just a reminder, why you're recommending these items. And then when you hit submit on that, a couple of things happen. First, you'll get a confirmation that quote's been delivered to the patient. And that quote and any quote you've ever generated will now show up. And it's so small on here, you can't see this, but it's going to say quotes right here. And so anytime you're logged into the Guru site, you'll be able to look at any quote you've sent any patient. Okay. And the status will update. So when the patient buys that cart of items, it will show that they've done that. If the patient says, no, I don't want it, it'll show that they've done that. And Judy is also notified, the lovely Judy is notified whenever a new quote is generated. And she has a protocol to follow so that she gives the patient a little time. If they go ahead and buy the cart, then she does nothing. If they don't buy the cart, the next business day, she will follow up and see if there's anything we can do to help them. She's able to help them buy that over the phone. She's able to help them, walk through the process and make sure that they have whatever hand-holding they might need to successfully get those items ordered. And and then as the patient either buys or tells Judy that they either, I don't need that, or I can't afford that, or whatever the outcome might be, she's going to feed that back to you so that you know the status and you know what's happening with that. And again, the link to set this up is in the chat. We'll answer any questions you have whatever. This link has been going.
Yeah, I'm
Which
I'm working on that right now on the back end. They are correct. I just went and tested it too, and it's going to a page
we
not
broke it
found.
already.
So
It's overwhelmed.
we've apparently
Overwhelmed.
broken. So I'm working on getting the real link, and I will
Uh,
get it by the end of it. So
it's been working beautifully all day. So we'll fix that and get back to you. But this feature, I think you're going to love it. But the other cool new feature we've added to the Guru site for medical professionals like you is what we're calling custom shops. Okay. And these are basically your very own shop within the entire Guru site that only shows the products you commonly recommend and lets you create custom combinations of products. The best example is like if you have a bandaging kit that you want a patient to have. So like maybe you have a standard arm kit. Maybe you have a standard leg kit. Maybe you have a lower leg kit. This allows you to take all the items that belong in your kit and essentially bundle them together and give it a name. So it could be like Lauren's arm kit, Labria's leg kit, Vanessa's leg kit, and or it could be your clinic name. Maybe all of you in your clinic use the same kit. You can create that bundle and make it available as a product in your custom shop. In that case, what simplifies everything, because the patient can just select that bundled thing, it's going to ship them every item in there, and it's going to just aggregate it to one price. And so a custom shop, here's a little bit of an example. A custom shop can be created for you as an individual therapist, or it can be created for your entire clinic to use. It's up to you. We have kind of two templates for that. Your custom shop has its own URL. So it would be compressionguru.com/Joshua Perkins would be Josh's custom shop. If your clinic name is Results Physiotherapy, it would be compressionguru.com/Results Physiotherapy. And two things are going to happen. We're going to give you that so that it's really easy to get there. But we're also going to generate a laminated one-page marketing piece with a QR code that goes straight to your custom shop. We're going to give you as many of those as you need, so you have one in every treatment room. And then you just have the patient point their phone at the QR code, and it takes them straight to your custom shop. And that is a huge time saver, and it gives you a way to just make sure the patient's getting to exactly what you want them to have. You can also combine these two features. We can create you a custom shop, and then you can go into your custom shop and create a quote for a patient using the items, and it just saves you time because it's narrowing the whole website down to just the items that you commonly use. So we create a custom shop, and then you can create a custom quote using the items in your shop. This way, referring the patients faster, and you can feel very comfortable that the patient's getting the lowest available price for these items because everything is available at the minimum advertised price. Okay? That's a good way to make sure the patient isn't paying any more than they have to. So the second key relates to this transition between active treatment from you and the next phase where patients will be responsible for at-home maintenance. This is typically where you're building a garment plan, and you want to make sure the patient has as many tools available for at-home maintenance as possible. So day garments, night garments, add any accessories that are medically necessary to help them be compliant. We're not at a point post-LTA where the vast majority of patients are now covered. We are at a point post-LTA where the vast majority of patients are now covered for compression garments. UHC commercial plans are really the main holdout, and we don't expect them to be able to deny coverage indefinitely. There's a lot going on in the background, and eventually they're going to have to get on board. The main question is where patients stand often with their deductibles. So referring them for a benefits check is always key. And you want to get this process going, ideally a few weeks before you're going to get ready to release them, especially if you know there will be custom garments involved. You want to give yourself 2 to 3 weeks, and everything will time out better, even if there are paperwork delays, other complications. Um, and
One
Go
question
ahead.
that just came in, are the items only limited to one specific company? And no, we work
No,
with all kinds of
no,
manufacturers.
absolutely. We
Yeah, yeah.
sell all the all the major and minor manufacturers. Are any manufacturer you've ever heard of that is willing to drop ship products is on Compression Guru. Judy is chiming in the comments because
Yeah.
she wants to make sure everybody knows everything.
Yeah.
Adnan, Waries, Juzo Medi, Solaris, Sigvaris, all the biggies, Essity, and plus some of the more nichey ones that certain people use. If the manufacturer drop ships, we carry their product on Compression Guru. There are thousands and thousands of products on Compression Guru, and items that don't drop ship often. If it's something you want to buy, we will inventory it because we do have a warehouse here in Nashville. And the reason we do that is because, like with bandaging and stuff, manufacturers will only drop ship by the case. So we break cases and boxes, and we'll sell you one of something, bandaging wise, if that's all you need. And so when we talk about building like a bandaging kit, if it's 6 of these, 4 of these, 4 of these, 2 of this, whatever, we can sell the twosies and the sixes and the even if a box is 10 or 12 or 20. So we sell them by the piece, we sell them by the box, we sell them by the case. Okay, and when you create a bundle like that, um, uh, you can it just simplifies the whole thing because the patient is buying arm kit, but it might contain 12 things, and you're just simplifying it all for yourself, for them, everybody. Okay. Um, the one way to make sure patients pay the least out of pocket is to make sure they get connected with a dealer who can bill their insurance in network. It always bugs me. This is one of the reasons that compression care exists. I would hear stories out there about how a billing company tells a patient they're not covered when the truth is that the biller just isn't in network. And so they're saying, it's not covered. But what they really should be saying, to be fully fair and truthful, is we don't bill that insurance. And so we've developed an industry first care coordination network so that whenever we're not in network, if you send us that referral and we're not in network, we will do everything we can to find a billing partner who takes that insurance, and we will work with you to get that transitioned where it can really work, and the patient's going to pay the least. Okay, really, really important. This is something we spent a lot of time developing last year after we acquired abilico.com. There were existing relationships with other billing companies, and we've been able to really get a lot of good cooperation going there, keep it going. And Ross came over, who's our director of patient intake and care coordination, came over with the Abilico team. He's doing a great job of helping make sure that we find homes for all of these claims when we're not in network. And we've developed relationships with some great regional billers who have some of these state plans and things like that. So it pays to just send it along. And if we can't do it, we will do our best to find somebody who can. And there are some like some state Medicaid plans, for example, that nobody wants to bill. So it's not a guarantee that somebody out there will bill it. But if somebody's out there, we're pretty sure we can find them for you. So as we go forward, just know that's something you're never going to hear from us, that something's not covered if the truth is that we're just not in network with it. I don't like that, and it's just never going to happen with our team. What's also made possible by the acquisition of Guru is our exclusive lowest out-of-pocket cost guarantee. What this means is that if a patient's out-of-pocket costs exceed the cost to just buy it directly from Guru, the patient's always going to be offered that option. Okay. And remember, Guru is selling at the lowest price allowed by the manufacturer. So you don't have to shop around. You don't have to send them looking any number of places. You'll know that what they're being offered is the least amount that they need to pay out of pocket for that. And sometimes it's real close. Like maybe they've got $300 left on their deductible, and buying it direct from Guru is going to cost them $275. They may opt to just use up the rest of their deductible and have this count toward that, but it's the patient's choice. It's up to them how they do it. Do you have, help me out here, do you have a DME
It's
POS?
DMEPO's approval for the CMMS to participate in Guru. Because Guru is a self-pay website, it is not required to have the DMEPOS
Yeah.
approval. We, as Compression Care, this side of the business, even though we are all we, right? But the Compression Care side of the business is DMEPOS approved. So we are DMEPOS, but Guru does not have to have that because it is a self-pay website.
Yeah, when patients aren't using insurance, none of that applies.
Yep.
Okay, uh, so lowest out-of-pocket cost guarantee means you don't have to worry. And even if we are using another billing partner from the Care Coordination Network, our deal with them is, hey, if this turns into a self-pay, we have made this guarantee to our therapists. We want to make sure that it gets referred back to us so that we can make sure the patient isn't overpaying. And so that's just another feature that we're working into that to make sure that patients never paying more than they have to. In addition to the lowest out-of-pocket cost guarantee, two more ways that we're helping patients with affordability. On the compression care side, patients have the option to break out their out-of-pocket costs into 3 equal monthly payments instead of paying all at once. If it's $20, we don't want to break that up over 3 months, but any reasonable dollar amount, we will break into 3 equal monthly payments. And this has been really popular, especially when patients have remaining deductible they haven't met. Here in the first part of the year, when everyone's deductibles have reset, this is especially helpful. What we notice is that in January, as many as 30% or more of patients have significant deductible barriers. By the end of the year, that percentage goes down significantly, and it's unlikely that you're going to find somebody who's been in active, lymphedema treatment that by the end of the year they haven't used their deductible. But here at the beginning of the year, it's particularly acute because people might have $1,000, $1,500 to $2,500 deductible that hasn't been met, and so they're out of pocket. And so having that low price guarantee is really key. And here during the first part of the year, it comes up a lot. And on the Guru side, we've added payment partners like Klarna and Affirm. So patients can break out any purchase on Compression Guru into 4 monthly payments. They just select Klarna or Affirm as their method of checkout, and then it puts them through a quick process. But I've done it personally just to see what the user experience is, and I can tell you that it's really, really simple, and it does for patients for whom this is important. It's really good because they're not paying an interest rate. We pay a discount, and Klarna pays. Klarna takes their end off of our end, and the patient pays the same. They just pay it over time. And if you have any questions about how that stuff works, let me know. But at this point, I would say the other, for patients, when cost becomes a real serious obstacle, on the compression care side, our case managers have the option to request extra help from our cost assistance program. For patients that are actively participating in the success of their treatment, they're actively participating with you. They want to get better. They want to get to a point where they can manage this on their own. And when they exhibit a strong commitment to being compliant, our cost assistance program will pay up to half the costs. And so our team members can initiate this, and they've been trained about how and when it's appropriate. And again, it all relates back to our mission to make high quality compression care accessible, affordable, convenient, no matter where you live. And affordability is one of those big three. So we're very serious about it. And our goal is we're trying to create a culture of yes here. And so we don't ever want to say no to somebody who is really actively participating in their healing and in their care if we don't have to. The last key I'll share today to help patients pay the least out of pocket is to always check insurance benefits. Let's talk about how we can make this happen in ways that don't always have to be 100% on you. I'm putting a link in the chat right now that is a place you can send any patient to submit a benefits request.
While he's doing that, I believe that link that we are posting earlier is the one that was saying page not found. It's going there because you have to be logged in already. And the fact that it works for us is because
that
it's logged in.
it.
I just put a link in there that says compressionguru.com/resources for medical professionals. And that gets you to where you can create a free Guru account, request access, and start sending quotes immediately. So that'll get you to the right page too. So that's right above the link that Stephen just posted. Just gonna let you know.
And so this link, the second link, you can send anybody there. It allows them to submit their insurance benefits. Doesn't put you through that extra step, although chances are better that you've already got their demographic. If you're seeing them, their demographics and their insurance info are already in your system. It's also a scenario where if there's a benefits check to be done ahead of time, so having the patient submit it is also a good gauge to know how committed they are to this next phase of the process. So it allows us to perform a benefits check long before they ever become a full referral, and it helps the patient understand what their costs could end up being associated with this. It puts the burden on the patient rather than you to figure that out earlier in the process. So it's the time commitment. If the time commitment is what's keeping you from referring patients for insurance coverage, this is a time-saving option. When you're submitting patient referrals via the Peace of Mind portal, we've designed that intake to give you some alternatives to sending along the full documentation package all at once. For example, if you have an office manager, a billing clerk, somebody in your clinic who has access to the paperwork that we're going to need, just tell us who that is, and we'll make a follow-up to get it directly from them. And if you'd rather we get insurance information from the patient, you can ask us to do that too. But just keep in mind that anytime we're putting the burden on the patient or someone else, now we're adding time. And so we're reliant on whether or not these people answer us, follow up, respond, all those things. But we can definitely work with others on your team and the patient to spread this burden out if that helps you. And that's one of the ways we're really trying to own more of the process and trying to work with you on things like paperwork. We all know documentation is a big bottleneck in this whole process, but it's also what keeps patient costs down, because without the documentation, we cannot file insurance. And so one begats the other. And so I think we look at it as patients with insurance coverage tend to order more garments. They're more successful at home during the maintenance phase because they've got the tools they need. We were earlier this afternoon, we were talking about how ways that you can incorporate, if you're going to incorporate Velcro wraps, how that impacts your garment selection, your overall garment plan, especially with a Medicare patient where you have these 3 and 2 limits. And it's interesting because what we find is that we get consistent feedback from patients who have a wrap as part of their arsenal. They'll say things like, well, geez, when I have a really tough day, I'll just use the wrap and I'll get it back under control, and then I'll switch back to the garment. And so to the day garment, and so patients having as many options as possible just seems to really increase the likelihood that they're going to be successful on their own. And so that's why having that insurance coverage, we know that patients tend to buy more when it's covered by insurance, and they tend to have more available to help them be successful. But every patient is different. So some will wear day garments religiously. Some will wear night garments because they're less obvious and no one sees it. It's important that patients have as many choices because you never know what's going to fit their lifestyle and their personality and what they're going to grab onto that they're willing to do in order to stay reduced and to kind of be in a healthy situation. So we've got a cheat sheet that we created. We've got a couple of them. I'm going to put a link to the first one, which is garment selection strategy. And what this helps you be able to know is which, what are some combinations of garments, especially when you're in when you're dealing with a with a Medicare patient. What are some combinations of garments that meet the Medicare standard, meet or exceed the Medicare standard, and give the patient as many choices as possible? These cheat sheets can be really useful at just kind of having some base plans to work from. Obviously, every patient's different. You gotta meet the patient where they are and what their needs are. But these help you kind of figure out some starting points that from which you can customize for any patient. All right, let's go to some Q&A. I know we've been answering them as we went, but here's another opportunity. If there's something we've been talking about and you still have questions about it, or you want to see something, or you want us to elaborate on any of these things, while we're doing that, this QR code will take you to the resources page for Big Day of Training. It's got for every session, we're doing 15 sessions all day. And for every session, it's got the slides. Tomorrow it'll have the video. It's got a quiz that you can take and get your certificate so that you can submit this to your accrediting body and try to get CEUs for all these things you've been doing today. And it also has handouts. It has anything that we've referenced today so that you can grab those and have them available. I highly recommend too, if you can, at 5 o'clock Central, which is about 2.5 hours from right now, we're going to be doing a billing specific, and there's a couple of big things that have come out of these Medicare TP&E audits that have been happening since the second half of last year, and it's going to have some real lasting impact. Compression Care is one of the charter members of the new Compression Dealers Alliance. Carmen, help me with Carmen's last name, Josh.
Anderson.
I keep wanting to say Electra. Carmen Anderson, who is with you probably know from the Manufacturers Alliance, going to be working with us also in the Dealers Alliance. And it's really designed so that we add another voice in the Medicare conversation and all these things that is kind of speaking for and protecting dealers. The Dealer Alliance has taken on as its first project creating a unified response so that based on what we're learning from these Medicare audits, as a group of dealers, we can come out with a single voice, single recommendation as to how this really is going to need to happen going forward. And there's a couple of, I'd say for once, it mostly doesn't affect you as therapists for once. It's going to really affect your referring physicians. And it affects us because it's increasing the amount of paperwork we have to get from the physician. And so this is going to become more and more important going forward. And I'd encourage you to sit in on that one. If you can't do it, just sign up for it. And then after the fact, you'll get invited to watch it on video. And then you can watch it anytime that you have a few minutes. But the second half of that is going to be really informative. And I would highly recommend it. And in the meantime, There's we have the cheat sheets. We have all the different links. And if there's anything else that anyone has questions on, we'll answer it. Otherwise, I really want to thank you for being part of Big Day of Training. We had
Absolutely.
we had a lot of grandiose ideas here, and I think that it's been popular. So we're really excited to have shared this with you. We'll clearly be doing it again. Vanessa wants to know, should we start with compression care for all long-term garments, especially garments? Definitely. Bandaging, yeah, and bandaging alternatives. Yeah, if you're part of this, there's a wraps. Velcro wraps have become like the hottest thing going, and what one of the factors that's driving it is, there's a couple of key factors. One is patients use them, like they like them. And they're easier to use, especially when patients have mobility issues, when they're obese, when there's a lot of scenarios where wraps are just easier for them to don and doff. But we're seeing so many therapists who are being told by your clinic or hospital, hey, you can't bandage anymore. And the gold standard that you've all been trained is bandaging. And so therapists are coming to us every day going, all right, what in the world do you do when you can't bandage? And the answer almost always is wraps and reduction kits, right? And because a wrap it's not a one for one trade, but a wrap can achieve reduction when you don't have bandaging in your toolkit anymore. And so, for example, Vanessa, you can incorporate a wrap early in your treatment process. You can initiate a referral strictly for that wrap, and we can get you a wrap or reduction kit that you can use in the reduction phase while you're getting this patient under control. And then once you're ready to transition them, you can then put them into day, night, and now they've got the wrap for when they really need something extra. And and wraps by default, Medicare counts a wrap as a day garment. However, you're not limited to that. And so these cheat sheets kind of run you through some scenarios, but like you can you can order that wrap from us, and you can say, please dispense it with a pad or a swell spot, because I want it to count as a night garment. Okay.
Yep.
So like a very common scenario, do a wrap early in the reduction phase. And then, yes, we do. And early in the reduction phase, we can get you that wrap to get this patient under control. You can count it as either a day or a night. If you count it as a day, then the first time you transition them to permanent garments for maintenance at home, you can do 2-day, one to wash, one to wear. Okay. And then you can dispense night simultaneously. And you can, or you can treat that wrap as a night garment. And then when you transition them to permanent, you can dispense 3-day, one to wash, one to wear, one in the drawer, and one more night garment. Okay. So it just kind of depends on, do you feel like this patient is more excited about night than day, or more excited about day than night? What are they more likely to be using? Either way, with day, if you count it as a day and you dispense 2 more day garments when they transition to maintenance, 6 months later, we can put them in 3 more days. So what happens a lot of times is patients, once they're into it, they're like, you know what? I need a black one. You know what? I want a purple one. You know what? I want that tie-dye one. And so over time, every 6 months, what we're doing is we're building their inventory. And we're doing that because when you give them things that they choose, boy, oh boy, they'll use it, right? And that's the goal. So we get real excited when patients show an interest in having something and telling us what they will use. They're telling you what they will use, essentially.
Yeah.
So
I'm sorry to do this, but I'm going to go get ready for the next presentation real quick. I got to meet them
awesome.
over there.
So
But
we'll
thank
wrap
you
here.
for everybody being here, and I'm going to jump
Absolutely.
off. But you guys feel free to keep going if you need to.
And Yolanda, the Rosidol soft, the Rosidol K, we have all that. We also have Essity right now, except Essity just did a huge price increase on their bandaging, and so it's not as affordable as it was. And we also have we have some other options, and I think we're going to be bringing in another bandaging line that has the affordability that the Essity did. So we're really excited about that. And when you have us build a custom shop and you can do these kits, it's your kit. It's what you want in the kit. So, for example, we just did one for a clinic in Ohio. They have clinic-wide, they've agreed on 3 different bandaging kits. They have an arm kit, they have a full leg kit, and they have a lower leg kit. And they specified what they want in there. And they specify right down to the brand they want, the length, everything. And so you might say, I need, let's just use Rosidol K as an example. You might say, I want 4 12s, I want 4 10s, I want 4 8s and 2 6s, or whatever your thing is. And it's kind of all based on what works for you. We can put that into Yolanda's arm kit, and then you just sell the patient Yolanda's arm kit, and they'll get everything that you want them to have. Can we quickly ship to Hawaii? We can. The patient is going to pay some upcharge on that, but we can priority mail, and it'll generally be 5-6 days under normal circumstances to Hawaii. And we send things to Alaska and Alaska all the time. And if you need me to hand deliver those to Hawaii, I will definitely be willing to do that. All right. Seeing no other questions, really enjoying time with you this afternoon. If you want to continue the conversation, you can head over to the Microsoft Teams virtual lounge, and we'll be happy to answer any more questions, provide any other answers you have. I think might be Judy, somebody from the Guru team will also be over there. So we look forward to seeing you, and we look forward to helping you get set up so you can utilize the cart to quote feature on Guru. You can utilize. We'll be thrilled to build you a custom shop. However we can help, and just know that we're continuing to always look for ways to manage affordability so that patients are never paying more than they have to. It's just one of our fundamentals that drives our company. Thanks very much, and thanks for being part of Big Day of Training. I think we're down to like 3 or 4 more sessions, and we're going to call it a day. But yeah, I'll get you the link one more time to the Microsoft Lounge, and I'll give you a second to click on that. Yeah, we'll get you over there, Kelsey. That link is there, so follow that, and that'll get you where you're trying to go. Awesome. Thanks, everybody, and we'll look forward to seeing you in other sessions. And tomorrow you'll be getting an email that has a link to all this. So if you didn't get it right now, don't worry, you'll be getting it tomorrow, and we'll take it from there. Thanks, and we'll see you soon. Bye-bye.